Okay. Hi, doctor. What's your name and what is your practice?
My name is Dr. AJ Khan. I'm a general dentist out in Sanger, Texas.
Why did you decide to get your training with Dr. Marsley?
Dr. Al Masri is an amazing clinician, very well known in the Dallas Fort Worth area. He's an amazing friend, a mentor, somebody that's very knowledgeable.
What level of training would you say you were at before you came to this course?
So before I came to this course, I was placing a few implants here and there. I've taken a ton of implant courses. I would say I've probably placed maybe 50 implants, and I wanted to really get into the full arch game. A lot of the didactic courses and cadaver courses were really missing that hands-on workflow, the hands-on patient experience. And even though no matter how many courses I took, I felt like I just wasn't comfortable to go into my office and execute, and I needed reps. And so that's why I saw this course and I reached out to, and I really wanted to be a part of this course. I think what Dr. Al Nasri is doing with the foundation and being able to give patients a smile, and allowing us to learn at the same time. There isn't anything really that exists in the market, and that's why I chose this course, because I wanted to do procedures on a live patient. I wanted to do it from planning, placing the implants, the 3D workflow, and then today we're here for delivery. So it's very comprehensive, and I had all the knowledge, like I felt like, but that tactile feel on an actual patient model, an actual patient is what I was missing. And so that's why I was really excited, and it's been a great experience.
How do you feel after the course? Do you feel like you can go in your practice and you actually practice what you've learned now?
Of course, yeah, no, I feel number one, the connections that I've built here with the other doctors, the team, the lab technicians, the assistants, just seeing the workflow process and how organized things are, it definitely has expanded my knowledge set, and definitely I feel a lot more comfortable. In fact, I have 3 arches planned next week that I'm going to be doing. So it was definitely that little bit of confidence that I needed to go into my office and do these next week.
So if you could give a few words for future doctors that are considering taking the course, what would you tell them?
I would say reach out to Dr. Al Masri and talk to him. He's an amazing person, very easy to talk to, and advice I would give them is you have to do it. You can never learn how to swim by reading a textbook or just doing it, practicing it. You have to get into the water, and you have to do this over and over and over again so that you get comfortable at it. And I think that's the one thing, especially for full arch implants, nobody is offering an ability to do these procedures in a safe environment in the United States, locally, in compliance with the U.S. standards and all your rules and regulations, and then kind of helping you with documentation and all that stuff. And you can follow up with these people and always call them and say, hey, I wonder how that patient's doing. We saw her 6 months ago or a year ago. Anybody can place an implant in a bone, but you want to make sure that if you're placing it, that a year, 5 years, it's going to integrate. And I think doing the course with Fasting Smiles and Dr. Riyad, that's what you're getting. You're getting the ability to work on a live patient. You're building connections that are US based, that are Dallas based. You are learning workflows, and you're doing it at a standard that it's going to be acceptable here in the US.
Thank you so much. So would you say one-on-one implantology meted your expectations that you had in mind?
It far exceeded my expectations. In fact, I'm going to come back and do it again and again. And You know, it's like peeling an onion. Every time you do it, you're gonna learn something new or get something different out of it. So I've already talked to him about coming back and doing more arches and getting into more complex cases. So yeah, definitely do it. It's a great experience.